They then come to the crossroads and I was completely ill-equipped.
They could tell that you're really tense and angry.
Every person who has experienced the care system has trauma.
Okay. So, do you think children in care are getting the mental health support they need in this country?
I would say no. I would say, just in general, nobody is getting the right mental health support at all. I think we've got really long waiting lists, and that is also a really big struggle for care leavers and children in care, simply because we have a lack of support in areas. We don't have necessarily, any family to reach out to for support. Very often care experienced people feel very lonely, and so that has a massive impact on our mental health as it is anyways. During a lot of care experienced people's experiences, we are probably going to suffer a lot more regularly with our mental health than the average person is, I would say. Because of these long waiting lists, we're not going to be getting the right support at all, and that just means mental health is worsening while we are waiting.
I do think things have really changed. There's a lot more mental health services available. So we have mental health in schools teams. There's a lot more increased capacity within CAMS. But I think it's about how children in care access those services. There's a lot of barriers. And I think when children in care have experienced a lot of trauma, and even if they didn't experience lots of trauma in their families, even just coming into care is a trauma that we really need to recognise is such a big thing, is like coming to live with strangers and stuff. We really need to recognise that. And it's even about, those foster carers or adopted parents. Do they understand how to access these services? Do the professionals that are working with this young person know how to talk to a young person? Are they trauma informed? Do they know how to access? So I think there's lots of barriers, but I also think for children in care, I think the trauma is the barrier for accessing some of those services.
There is pockets of places across the country that are able to provide amazing mental health support, but I don't think children in care are able to access it. And I think that the people that are doing amazing work don't know that children in care can't access it. And I think if they were able to understand the situation and the barriers, they would want to break them down. So no, I don't think we are at the point yet of providing adequate support for children in care. If we could break down those barriers and get a really thorough assessment, and that we could get professionals talking and understanding everybody's individual needs, then that would be a really big step forward.
I agree on this. I think that there is some really good schemes out there and some really good resources and people who do know what they're talking about and what specific challenges people in care and care leavers are facing. But yeah, I don't think enough PAs know about them. I don't think enough support teams know about them. And it's that signposting that I think we're struggling with a lot.
Okay. What do people get wrong about children in care and mental health?
Good question. I think people make assumptions that young people in care understand what mental health is, whether that's good mental health well-being or poor mental health well-being, or what mental health is. I think there's an assumption that we just happen to know it. And I think that's not the case, because I think when I look at my story growing up, I didn't really understand mental health. It wasn't something that was spoken about in my household. I didn't know what it was, let alone how could I work on it or say that I was having a good mental health day or a bad mental health day. I think that a lot of young people who are care experienced have some form of trauma experience. And I don't think people understand the correlation between trauma and mental health and how do we navigate it. I went through a lot of trauma and I think it impacted my mental health, but I didn't realise that it manifests in different ways. So for some people, it could be in their behaviour, some people, their characteristics. And I think a lot of professionals don't understand that young people are not always open to talking about it. It's a taboo kind of topic. And I think for me, I really struggled with it. I didn't know what to say or how to handle it. I think it was just a lack of understanding, I guess, in my case, when it came to mental health. And I think it manifested in a very different way in my life compared to other people's lives.
There's like this stigma and assumption that we're just like misbehaving children. Everybody sees the outward emotions in the way they're behaving, but no one ever sits down and stops to reflect and think, why is a child behaving like that?
A lot of their information based on psychology will come off as inauthentic or inaccurate to common kid. So they'll typically push away support anyway and try to solve it themselves. I didn't like the support that I was getting. I thought it was inadequate, and they were focusing on labelling the subject and thinking about diagnoses instead of looking at the individual like a case-by-case basis, which with trauma is very specific to the type of trauma you have. You can't treat it like a blanket term. It's not an individual diagnosis, it's a topic of diagnosis, if anything, a field. So it's specific to the individual.
Several things. I think one is not asking about it, not having the language to use, being afraid to probe too deep, being afraid of what answers might come out, not involving the young person, not knowing what the impact that mental health can have on that young person's journey.
Our service is doing a good job of meeting the mental health needs of children in care.
I don't think there's enough being done for children in care. I have the things that I've experienced, and I know what trauma is, and I know what happens, and I've met other people, and I know that. And I can confidently answer no, that not enough is being done. And I can give you the reasons why I think that is, which I do think is because of the way that upbringing will shape you. In the most morbid terms, I don't think the trauma ends. From the moment you go into care, for whatever reason you're in care, growing up, being a care leaver, it doesn't end, it just keeps eroding, I suppose. And I don't know what the answer is there. I don't think the people who should be asking this question are asking this question because I'm asking this question, you're asking this question, we're asking this question, and we're saying, what are we actually doing? What could we be doing, because it does erode at you and it does chip away slowly. I don't think the CAMS to adult services transition is clear at all.
I can't even tell you the number of times I've been called out because the crisis team weren't available to give support, or they were so stretched that they were dealing with other people first. I've literally fetched people from a bridge, from traffic lights. Now, they probably wouldn't have attempted the suicide, but they were asking for help. Yeah. And it got to that stage. And we haven't got a huge caseload of people, but it exists in the small caseload that we have. So the problem must be huge.
You're touching on like suicide and such. I've got to say, the mental health for suicide is very bad. Like, I mean, it's, for things like CAMS, for example, it's been widely criticised just by my peers, and I've had to like grow up with these other care kids, and they have a complete disillusionment with the system. A lot of them are borderline suicidal, and I've had to talk them out of it from the perspective of a peer that they respect more than any social worker that they're talking to. And it's I understand why. It's because of other problems, like not being able to be there as soon as possible, not having enough like foster carers or social workers on hand as well to go straight to the issue. And I have a feeling like it's a lot of things to do with funding. Short notice, they don't do that very well at all.
No, the continuity of social worker in somebody's care is
there's been
a serious issue.
There's been instances where you've had to supply me food because social workers and other people on the team weren't available.
Yeah, the safety net wasn't there, yeah.
There was no safety net, and that's the main, that is exactly it. There's no safety net, and the smallest oversight completely cripples the care kid. So they're dealing with the consequences of the smallest possible oversight, like one carer going on holiday or no one compensating for the lack of availabilities.
But I think as a system, we're all starting to work together and support children and adults. I just think we openly talk about it, but I just think we need to keep doing that and push forward.
For sure, we can always do more and we can always progress. So that's what I can say on that.
It's really good.
I've been Finch and you're watching the UK Trauma Council.